Hello everyone, welcome here to the University of Adelaide today. My name's Rebecca Tour and I'm the Program Coordinator for the Bachelor of Health Sciences here at the Uni, and I'm going to talk to you for a little while about our Bachelor of Health Sciences degree. So the Bachelor of Health Sciences has been offered at this uni since 1990, and it was designed right from the start to provide a broad education relevant to the healthcare and the health industry. The Bachelor of Health Sciences is a great choice for students who are interested in human health and healthy communities. The Bachelor of Health Sciences program aims to equip graduates with the knowledge and skills in the health sciences that would be appropriate for entry-level graduate positions in the health and related sectors, for example, local government. The program also provides a firm foundation for postgraduate study in health professions such as medicine, physiotherapy, dietetics and nutrition, and paramedics. The Bachelor of Health Sciences is designed to provide a broad education for students interested in health, and it's structured so that students can pursue pathways in both population health and biomedical sciences. It's a 3-year degree, and there are no prerequisite subjects. It offers a broad range of choices. Initially, students can undertake courses in the areas of human biology, public health, basic pathology, and the prevention and therapeutic management of disease. So these are the compulsory courses that provide the basis for majors in a range of areas that I'll talk about in a little while. So the program offers an integrated and multidisciplinary approach to healthcare, and there's an emphasis on the development of research, communication and lifelong learning skills. In recent years, ongoing rapid change in the healthcare sector has heightened the demand for skilled graduates who can work in government and private agencies and in programs in the context of changing public expectations, the ageing of the population, and a global trend towards a more integrated and multidisciplinary approach to healthcare. So the breadth of coursework that's available in the Bachelor of Health Sciences program offers students the opportunity to develop knowledge and skills that will meet these needs while also providing you with depth in areas of specialisation. So now I'm going to talk a little bit about the core courses. Beg your pardon, there we go. So students complete 4 3-unit courses at level 1 and 2 3-unit courses at level 2 to fulfil these requirements. So at level 1 your core courses are in public health and human biology, and in second year you do basic pharmacology and pathology. So public health 1A and 1B introduce students to the multidisciplinary population view of health and provide essential knowledge about disease prevention, health promotion, and with an orientation towards prevention, early intervention and primary care. In Human Biology 1A and B, students investigate the relationships between normal structure and function in human cells, tissues and organs, and the mechanisms that maintain homeostasis, organ systems and the structure and function of the human body. At level 2, or in your second year, Drugs, Chemicals and Health, which is a basic pharmacology course, introduces pharmacological concepts and principles needed to understand the effects of drugs in humans. And Biology of Disease provides the basic general introduction to pathology. Okay. We're going backwards. There we go. Sorry. So this diagram is really helpful for understanding the breadth of study options available in the Bachelor of Health Sciences and where this degree fits in relation to other health degrees. If you imagine that this diagram represents a spectrum of human health, at one end, down at the bottom of the arrow, we have the basic building blocks of life, the molecules and cells. Moving up the arrow, we come to organ systems, then on to individuals, then families, and finally society. Each of these is the concern of certain disciplines of health science, from molecular and cell biology, through pathology and physiology, through clinical medicine, to public health right here at the top of the arrow. You can see that these disciplines cross over so that molecular biology can study human health at the level of molecules, genes and cells. Cell biology focuses as well on organ systems. Pathology and physiology combine these focuses and include concern for individual health. And clinical medicine combines all of these to consider health at an organ, individual and family level. Right at the top, as the arrow spreads out to its widest, we have public health, which considers health in its broadest terms at an individual, family, community and societal level. Finally, the diagram shows you how the compulsory courses that you will study in first year public health, human biology, pick up on the spectrum. And many of our students also choose to study extra biology at first year by taking the first year course, Molecules, Genes and Cells. So really you can cover that whole spectrum in that first year and get a really good taste for what health sciences is all about. So here's another way to have a look at how the degree is organised. Here you can see the first year compulsory courses at the top there, and then the second year you have 2 more compulsory courses. You can also see that in each year, half of your credit units could be taken as electives, and Molecules, Genes and Cells, the biology course, would be one of the electives you might choose. From second year onwards, you can start to choose your courses that are part of the majors that you're working towards. So a major is a series of related courses in one discipline or interdisciplinary area. And for next year, all majors in the Bachelor of Health Sciences will be made up of courses at first year, second year and third year. For the majors in the Bachelor of Health Sciences, we've structured the degree so that almost all of them are possible simply by taking the core courses at first year. So you don't have to know right from the start which of the majors you're interested in. But if you do, you can start making your degree plan from day one. And we provide students with heaps of assistance for how to make these plans right throughout the 3 years that you study with us. So what are the majors you can take in the Bachelor of Health Science? Well, here's the full list. There's really lots of choices. So you can do Anatomical Sciences, Human Reproductive Health, Neuroscience, Nutrition, Pathology, Pharmacology, Physiology, Epidemiology, Health Promotion, Indigenous Health, Psychology, Biochemistry, Genetics and Microbiology. So for the first time next year, there'll be 3 public health related majors. So that's the majors in Epidemiology, Health Promotion and Indigenous Health. So these majors have been developed to align more closely with careers in population health than the single public health major which they replace. The change also allows students who are interested in public health to specialise in the area that most interests them. At the moment, we are also strongly considering introducing a new major in exercise science, and you can see that's why I've got the little star next to that one. So this major has not been approved yet for teaching, but in part it will prepare students to work as exercise or sports scientists. There'll be other courses needed, and for some students it may provide a path to further postgraduate study in exercise science or exercise physiology. So apart from that, the other thing to know about the majors is the psychology major and the 3 majors offered by the School of Molecular and Biomedical Science, which are part of the Faculty of Science. So that's the biochemistry, genetics and microbiology majors. They're the only majors that require additional level 1 courses to be taken in order for them to be possible. So all of the other majors, the core courses, are all you need to be able to go on to any of these majors. So now I just want to talk a little bit more about some of the areas of specialisation you can choose in the Bachelor of Health Science. And this picture is a really great way of understanding how some of the disciplines of health science come together when we're studying a human health problem. So here is a photograph of a person undergoing a heart operation. The operation is needed to restore blood supply to the heart, which has resulted from heart disease caused by smoking. Smoking is a health issue that can be tackled by many areas of health science. We could start with the anatomy of the heart. What is the normal anatomy and microstructure of the heart, the blood vessels and the lungs? What structures would a surgeon encounter in exposing the heart for a bypass operation? What veins in the body could be used to provide the bypass? Or we could look at the physiology. What makes the heart beat? Which proteins make these functions possible? We could look at the pathology of the heart. What structural changes occur to the heart, lungs and blood vessels when someone is a smoker? And how does smoking cause life-threatening disease? We could consider the pharmacological aspects. What effects do the toxins contained in cigarettes have on the function of the heart, the lungs and the vascular system? And how do drugs restore this function? How can we treat nicotine addiction? We could also look at the psychology. Why do people smoke? What is addiction? How effective are quit smoking campaigns? And do different groups need different information about quitting? Or we could look at the public health questions, thinking about the whole population. How widespread is smoking? How much disease and disability is caused by smoking? How much does this cost the health system? What are cost-effective methods to prevent smoking-related illness? And what strategies can we use to evaluate how effective tobacco control measures are? So that gives you some ideas about the various areas of health science that can be used to study human health problems. Now I'm going to talk a little bit more in detail about some of the disciplines you can study in the Bachelor of Health Sciences. So we'll start with public health. As you have seen, public health is one of the two key streams in the Bachelor of Health Sciences. Public health is the organised efforts of society to promote health, prevent disease and prolong life among the whole population. Public health is not the same thing as public hospitals. In public health, we study patterns and trends of health and ill health, and we look for the causes of illness and disability at an individual, community, social, environmental and political level. So, for example, how many back injuries occur in the workplace? What is the best treatment? Are there strategies, workplace policies, legislation or education that might reduce the incidence of back injury? In public health, we're interested in what strategies we can use to promote healthy lifestyles, to prevent disease and injury. So here are some more examples of public health actions that have improved the health of the population or prevented disease. So education about breastfeeding, health promotion to improve nutrition, immunisation, tobacco control, occupational health and safety strategies, compulsory use of car seat belts and clean air legislation are all public health actions that have resulted in major improvements in health for the population. Even when we can't prevent disease, though, we can use screening to detect problems early because we know that most problems are easier to treat and the treatments will be more effective if we can catch them early. So there's population-based screening for all these types of problems. So what will you study if you do public health? Well, apart from the first-year compulsory courses, as I said before, there are now 3 majors in public health to choose from: in epidemiology, health promotion and Indigenous health. So you'll study the compulsory first-year public health courses, then in second year you choose 2 or 3 public health courses leading to the specialised courses in each of the majors in your third year. Every student completing a public health major will do what is called a Capstone Course. This is a course which brings together all your learning across the 3 years of your public health major, as well as ensuring that you graduate with the skills needed to be a beginning public health professional. For students with a good academic record, there is also the possibility of doing a public health internship, where you are placed in a workplace for 1 to 2 days per week. You can also choose additional electives in evaluation, rural public health, and international health. So if we move on to Anatomical Sciences, anatomy is the science that studies the structure and the form of different organisms and the relationships between the various parts. In Anatomical Sciences, we study structures that we can see with the naked eyes, organs and systems of the body, and different components of these structures, tissues and cells that we can see under the microscope. Understanding of anatomy and the different anatomical systems such as the skeletal, muscular, cardiovascular and nervous systems and their components such as the muscle cells and neurons is essential for the practice of medicine, for understanding disease and for studying human evolution. For example, we can ask, why are some people more prone to backache? How much variation is there in the structure of the spinal cord and the vertebral column, and all of the related muscles, ligaments, discs, nerves and blood vessels? And what changes will occur with age? So what will you study in anatomy? Well, again, in first year you'll have the compulsory course Human Biology, which goes across semester 1 and semester 2. You'll do human anatomy with dissection. You might study microscopic anatomy, neuroanatomy, reproductive biology, and human evolution and forensic anatomy. we move on now to pathology. Pathology is a scientific discipline which involves the study of diseases such as infections and cancers at the genetic, molecular, cellular and organ levels. So pathology looks at how and why diseases develop, what the disease process is, what happens to our bodies when we're sick, and the effects of diseases, including their symptoms and complications. We can also look at what the risk of certain diseases is and how diseases might be prevented, what is the cure rate, and why surgery is common and important for some diseases. So in pathology, we might ask, if a person dies in a car accident, what is the cause of death? Was it a heart attack before the crash? Or was it a result of the impact from brain trauma caused by the accident? What causes traumatic brain injury and can we prevent it? Understanding the biology and pathology of disease helps to better develop diagnostic tests and better treatment and prevention plans. So in pathology, you'll start your study of pathology with the core course in second year, Biology of Disease. And if you go on to do a pathology major, you will then be able to study general pathology, neurological diseases, and topics in forensic sciences. So Topics in Forensic Sciences is a very popular course in third year. It provides an overview of topics within the area of forensic sciences, including pathology, toxicology, anthropology and odontology, and insights into how they might be used in crime investigation. Body changes with death and decomposition, pathology of wounds, burns, disaster victim identification, sudden death in children and adults, medical misadventure and drug-related disorders. So that full spectrum of forensic science. Moving on to pharmacology. Pharmacology is the study of drugs. It involves examining the interactions of chemical substances with living systems so we can understand how drugs work, including the interactions between drug molecules and drug receptors, and how these interactions elicit an effect. In pharmacology, you will learn, amongst other things, the various classes of drugs, how they are used in medicine and healthcare, how they work, and the impacts on the body. You'll also study toxicology, which is similar to pharmacology but focuses on the adverse effects of drugs and chemicals on the human body. So toxicology will focus not just on drugs but environmental agents and chemical compounds that may have toxic effects. This can include disturbances in growth patterns, discomfort, disease or death of individual organisms, or at an environmental level on whole ecosystems. So we might ask, how do drugs relieve backache? What is pain and how is it controlled? What are the side effects of painkillers? Why are some drugs potentially addictive? And can addiction be cured? So if you do a pharmacology major, you'll start your study of pharmacology in second year with the compulsory course Drugs, Chemicals and Health, and you can go on to do another pharmacology course in second year if you want to specialise, and then go on in third year to study pharmacology throughout your third year major. Moving on to physiology. Physiology is the study of how living systems function. Physiology study living systems from the subcellular level, so molecules and organelles, all the way to the level of the whole organism, as well as how organisms adapt to different environmental conditions such as hot and cold, high altitude. Human physiology is concerned with how the human body works, especially the organ systems. So that's the collections of cells, tissues and organs which have dedicated functions in the body. So in the human body, organ systems include the nervous system, the cardiovascular system, the musculoskeletal system, the reproductive system and the immune system. So we might ask, how does the brain control movement? Why does skill improve with practice? How do we interpret visual information? As we saw earlier, what makes a heart beat and which proteins control all of these functions? So what will you study in physiology? So you'll study human physiology. You'll also study systems physiology, so how the major organ systems of the body perform their normal functions and how these are regulated and integrated. You'll also study neurobiology, the study of cells in the nervous system and the organisation of these cells into functional circuits to process information and mediate behaviour. And you can also study a number of exercise science and exercise physiology courses. Some of these will become part of our exercise science major if we do introduce one next year. Psychology. So psychology is the study of the human mind and behaviour. In psychology, we seek to understand and explain how people think, act and feel. Psychology covers a wide range of areas, including how we learn, how we make decisions, the biological basis for behaviour, and the social cultural influences on our attitudes and relationships. In psychology, there's a wide range of different courses to take. A psychology major in the Bachelor of Health Science includes study in these areas, and students who complete a major with excellent grades will be eligible to apply for honours in psychology. This is the first step on the pathway to becoming a registered clinical psychologist. Honours in psychology leads to the Masters in Psychology, again for eligible applicants, which is the professional qualification needed for practising as a psychologist. We also have a number of majors that are interdisciplinary, so they combine different disciplines but with a common theme. So one of those that's been introduced in the last few years is nutrition, which combines human nutrition and food science. We also have neuroscience, which combines pathology, anatomy and physiology, and reproductive health, which combines anatomy and human reproductive biology. We move away from the majors now. As well as studying the courses that contribute to a major, or majors, from 2014 every Bachelor of Health Sciences student will also need to choose at least 3 courses from outside of the health sciences. And these are going to, these are called Broadening Electives. So you can choose your Broadening Electives from courses offered by all the other faculties, except those courses that are restricted to certain named degrees like law and medicine and some of the engineering degrees. So there's a very wide array of electives that you can choose from. And as I mentioned earlier, at every level you can take half of your courses from this list of electives. It's also possible to do double degrees in health science. So we have health sciences degree with social sciences, with mathematics and computer sciences, and you can also do health sciences with the Bachelor of Laws. It's also possible to put together other degree combinations in what we call concurrent degrees. So, for example, there are students doing health sciences and pharmaceutical engineering, and students doing international studies with health sciences, arts and economics. So why should you choose Adelaide for the Bachelor of Health Sciences? So in the Bachelor of Health Sciences at Adelaide Uni, you will receive individualised study planning for every first year student. That was introduced this year, and we managed to see 275 students in the first 4 weeks when enrolments opened. That was about 78% of all first years came in for a one-on-one session. This really helps students to make a plan and know exactly what it is that they're trying to do with their Bachelor of Health Sciences. We have an excellent peer support program called Synapse to help with the transition to university for first years, and to help with your academic progress. We also have peer-assisted study sessions which are available in our first year core courses. One of the real strengths of this degree is the ability to tailor it to match your career aspirations. So we will work with you throughout the 3 years to be able to plan where you're going and choose the courses that will best meet the needs either of your postgraduate study or the jobs that you're looking for. We also have graduate career readiness activities at every year of the program from first year onwards. Other strengths of the program include links with employers, and we have excellent links with hospitals, research centres and institutes, government and private industry, and the professional bodies. And lifelong learning. So one of the key graduate attributes for health science graduates is the ability to be able to read, interpret, critically analyse and communicate scientific information and data. And this is a skill that you can use in a wide range of different careers. It's an excellent pathway to graduate study in medicine, dentistry, physiotherapy, chiropractics, dietetics, nursing and paramedics. Being that we're in a research-intensive university, it has an excellent research underpinning, and it's really a caring, friendly and supportive environment. So there are a range of postgraduate options available in the after the Bachelor of Health Sciences at this university. You can always go on to do honours, research masters and a PhD. We have a range of other coursework masters, including in addiction studies, biostatistics, counselling and psychotherapy, health economics and policy, occupational health and safety, psychology and public health. There's a diverse range of career opportunities, including in medical research laboratories, in university and hospital pathology labs, in forensic science, and in government agencies, including the Therapeutic Goods Administration, the State Department of Health, the Drug and Alcohol Services, and Department of Human Services, the CSIRO. If you do go on to do psychology, there are a range of different roles in psychology depending on which way you decide to get qualified. You can find work in pharmaceutical industries, in non-government agencies such as the Red Cross and Oxfam, consumer organisations such as the Asthma Foundation and the Cancer Council, and of course one of the benefits of high degree research is it opens the door to endless opportunities in travel. So one of the other things that is really exciting at the moment about the University of Adelaide is that, as you would have seen, I think if you've noticed any of our marketing, we have a new strategic plan. We have a new Vice-Chancellor who came last year and developed a new strategic plan with the university, which is called the Beacon of Enlightenment. Now, the Beacon contains a number of really fantastic ideas that are going to improve the university and the experience for students moving forward. And one of those is that there will be advanced degrees offered in every program in every faculty in the university. And the Bachelor of Health Sciences is the program where an advanced degree will be offered. It's not been approved yet by the university, but we expect from next year to be able to offer an advanced degree in health sciences to students with an ATAR of 95 or above. It will offer a unique cohort experience for students from the first year, and the focus of the degree will be on preparation for research in the translational health sciences. So translation is about getting research into practice to actually make a difference to the health of the populations. So from next year, the advanced degree will have majors in reproductive health, epidemiology and nutrition. And those three areas really fit really well together for translating research into practice. So if you are a person who is likely to meet the entry requirements, I think the advanced degree is a really amazing opportunity to develop in areas that are going to be so essential for meeting the needs of the healthcare system into the future. So that's something to look out for in the next few months. But back to the standard degree. The Bachelor of Health Sciences itself has no prerequisites. It is useful if you like biology or you've done biology. In 2013, the ATAR was 65 and we had 395 students enrolled this year. There's entry pathways for school leavers via TAFE, through the STAT test and also for tertiary transfer. And we also have a university preparatory program pathway for people who may need to do some preparation before they come to university. If you've done TAFE, there's some accredited pathways that give you credit into the program right from the start. You can do it full-time or part-time if you want to, and students can start at mid-year. You can expect to be studying about 16 to 20 hours each week. Here's a story from one past graduate. This is Joseph Schetti. He now works for BHP Billiton. He did a Bachelor of Health Sciences and then followed that on with a graduate diploma in Occupational Health and Safety Management, and he now works in the mining industry. So that gives you a bit of a feel for the kinds of pathways people can take from a basic degree like the Bachelor of Health Sciences. So if you'd like